Hello, everybody. How are you? Happy Thursday. I'm so happy to be back. It's been a while. I've been busy teaching 2 classes this summer, enjoying some family time with a couple vacations over the summer, but I'm happy to be back, ready to share more tips, tricks, knowledge, advice with all of you. Hello, if you are watching on Instagram, thank you for being here. Hello, if you're watching in the Clinical Connections Mentoring Facebook group. Also happy to have you here. So today we're going to be talking about all things related to communication, right? So how to communicate with your superiors, like your bosses, or maybe your CI, or even your professors. We're going to be talking about how to communicate with your coworkers, especially those difficult or hard to work with coworkers. And then we're going to talk about how to connect and communicate with your patients so that you can provide effective treatments with them. So this will help you. Just what I'm going to talk about today is going to help you easily have those difficult conversations, or even just figure out how to start conversations about tough topics, or just learn how to better work with or talk to all of your patients. Okay, that's my goal for today. For anybody new here, whether you are watching on Instagram or you're watching in the Facebook group, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs. I've worked in acute care, oncology, outpatient, skilled nursing, home health. I've been a rehab director. I've done adjunct teaching. And now I own my own cash-based practice in Florida. And I'm also the owner of Clinical Connections Mentoring, which is where you are today. So what I'd like you to do, if you are watching live, please type in the comments. Tell me who you are, where you're watching from. Same thing, just type it in the chat. I like to know who I'm talking to. If you are watching the replay, please type replay, tell me who you are, where you're watching from. Also, I would like you to drop in the comments, whether you're watching on Instagram or Facebook, let me know, tell me, what's a tough conversation that you see yourself needing to have in the near future, or maybe a topic that you feel like you need a little bit of help figuring out how to kind of bring that topic up or how to start that conversation with somebody. So drop that in the comments, kind of the premise of what you want the conversation to be, and maybe why it's tough for you to either start it or actually have that conversation. Okay, so as a PT, there are a lot of people that you need to communicate with on a daily basis, right? This includes patients, family members, other healthcare providers, right? Doctors, nursing, whoever, coworkers, and bosses, right? As a student, you have to talk to your classmates, your group mates, your professors, and definitely your CIs. So if you can't communicate effectively with your patients about what they need, then you can start to feel kind of helpless when you hit that wall, with knowing how to treat them, how to help them during their rehab process, right? If you can't communicate effectively with your patients, and their family members, then you can start to feel some frustration if the family member isn't supporting the patient how they need to be supported. If you can't communicate effectively with your coworkers or your classmates, then you can start to feel kind of irritated because maybe you feel like you're not being heard by those that you're working with, right? If you can't communicate with your boss, you can feel isolated or angry or overwhelmed by certain maybe work related expectations that seem out of reach or unrealistic or unethical or illegal. This might look like maybe going to work every day angry because you have to bill 4 units with every patient, or you feel overwhelmed because you always have to stay late to get your documentation done. You don't have time. You have so many patients at one time, you don't have time to do your documentation. You always have to stay late. That starts to feel overwhelming. Or maybe you just feel exhausted because there aren't enough techs to help you with all of the patients on your schedule, which also kind of makes you feel a little bit isolated and alone, like nobody's there to help you, right? Here you go, and you're not getting the help that you need. If you can't communicate with your CI, maybe you're a student or getting ready to go on a clinical. If you can't communicate with your CI, you can feel nervous, you can feel anxious walking into your clinical site every day because you don't know what's expected of you or even where you stand, whether or not you're going to pass the clinical, right? This looks like starting each day, your clinical super stressed out, trying to guess what your CI wants you to do each day, trying to figure out even if you're on the right track with your patient's treatments or if your documentation's up to par, how many people you're supposed to see by the end of the week, all these unknowns, right? that can make you feel really nervous and anxious on your clinicals. And all of these feelings, nervous, anxious, isolated, angry, confused, overwhelmed, all of these are the exact feelings that can lead to that slippery slope that's going to trigger some burnout. Okay. Starts with avoiding your boss or your CI or not saying anything at all, just avoiding the topic altogether. Who's done that, right? Who just decided, you know what, I'm just not even going to do it. I'm not even going to bring it up. It's not worth it. Right. But then you do that. And then you start to kind of bitch about it to your parent, to your PT friends, or maybe your classmates while you're out for drinks on a Friday night. They start to complain, bitch back, they're complaining back, and you feel like, oh, there's just no hope for me in any PT job because everybody's complaining about it, right? Then you notice that you're often snapping at your significant other and you're telling, this is just how it is to work in the PT profession. This is how it's going to be. Before you know it, you're even more stressed, more frustrated. You haven't made any progress on the original problem, and that cycle just continues and it gets worse each time, right? So let's talk about some steps that you can take to start that conversation for each of the examples that we just talked about. Okay, so let's start with having a conversation with your boss. So those of you that are already working in a clinic, you want to have a conversation with your boss. Let's say that you notice some unethical things are happening in the clinic that you work in. Maybe therapists are billing Therax without actually providing any actual skilled services, right? You're noticing these things and you want to talk to your boss about it. First step you would do, just take notes, write out, what do you want to talk to your boss about? Grab a piece of paper, just write down everything that you want to tell your boss about what's going on, right? Step two, document like examples. What are the exact things that you are seeing happening in the clinic? Gather all the examples that you can gather some evidence, write those down, right? If you write it down, you're not going to forget it when you talk to your boss, right? Step three, ask for and set up a meeting with your boss, right? Get it scheduled on the calendar. Sometimes bosses are often going in 12 different directions. They have 18 different meetings to attend. Ask for a meeting with them and get it scheduled. Get it on the calendar so it's on paper, in writing, the time is set, and that's when you will meet with him. Step four, actually have that meeting with your boss. Talk about those concerns, right? Everything that you wrote down, all the examples that you have, all the evidence that you have, whatever you wrote down, tell your boss. Bring it up. It's written now. You know you're not going to forget it. Okay. Step five, when the meeting is over, document how the meeting went, right? What did your boss say? Did anything come out of the meeting? Did you guys agree on anything? Is anything going to change? What was the outcome? What did you guys talk about? Write that all down. Step six, which hopefully you don't have to get to, would be setting up a meeting with HR if you need it. So if you came up with a plan with your boss, still nothing changed, there were still some problems, step six would be to set up that meeting with HR, but it would be the same series of steps. Write it all down, bring the evidence, okay? All right, now let's talk about having a conversation with your CI. If any students are watching, anyone going on a clinical, getting ready to go on a clinical, or already in one, okay? So let's say that you're constantly confused by some of the feedback from your CI and you have no clue where you stand on your clinical. Am I passing? Am I not passing? What's happening? You have no clue where you are. Step one, take notes. Write down what you want clarification on. What are you confused about? Write out the exact things that you want to ask your CI. Write them out. If you're confused about what your expectations are, write that down, right? Remember, if you write it down, you're not going to forget to bring it up. Step two is going to be asked to meet with your CI at a specific time, maybe during lunch break or maybe at the end of the day on Wednesday, whatever. But ask your CI, hey, I would like to talk to you about some things. I have some questions. Let's set up a time to meet. Okay. Step three, have the meeting, right? Ask your CI what is expected of you by the end of the week, right? If that was what you were confused on, you need clarification, ask them. Just straight up ask them. Ask them what they expect you to be doing by Friday. What do they expect you to be doing by the end of the month? Whatever you wrote down about what was confusing to you or what was unclear from your CI, you write it down, literally ask them. Okay. Step four, create a plan with your CI in that moment to meet those expectations. Okay. A lot of the times when students have trouble on clinicals, it's because of communication. They don't know what their CI expects of them, or they're not communicating how they feel to their CI. Okay. So for both of the examples we've already talked about, whether it's talking to your boss or talking to your CI, these people, anybody really, but specifically bosses, CIs, They can't help you if they don't know that you need help with something. They're not mind readers. Nobody is a mind reader. Your CI is not a mind reader. Your boss is not a mind reader. If you do not tell them, they may not think anything's wrong. They may not think that there's a problem. They may not think that you need help with something. You have to tell them. You can't get help unless they know, and then you give them ideas of how you can help or where you may need direction. Okay. All right. Now let's talk about having a difficult conversation with maybe a coworker or a classmate or group mate. Okay. So let's say that you repeatedly feel kind of taken advantage of by a coworker or classmate. Maybe your coworker's always asking you to cover their weekend shift. You did it once, they keep asking, and you don't know how to say no. Or maybe you feel like you're always picking up the slack from your classmates in a group project, right? Who's done that? Group projects, nobody loves them. They are kind of necessary, but there's always one person that's just not pulling their weight. And maybe you feel like that's you. Maybe you're always having to pick up the slack for that person, right? Step one is going to be write down everything you want to say to that person. Why is it? What is bothering you? And why is it bothering you? How does that make you feel, right? Then ask to have a chat with that person, whether it's coworker, group mate, whatever. Have a conversation with them, set up a time, have that conversation, right? Share your examples, tell them what's happening, what's happened in the past, how has it impacted you, how do you feel about it? Again, they may not realize that they're not contributing or that you're picking up all the slack. Tell them what is happening, give them the example and how it's impacting you. Step four, figure out a solution to the problem, right? Between the two, you and the other person. Listen to what they have to say, right? There needs to be a conversation there. It's not just in a situation like this. Excuse me. A situation like this, when you're working with an equal, right, your coworker or classmate, there's also another side to the story, right? So when you have the conversation with them and you share the example and how you feel, give them an opportunity to share how they felt about that situation and actually listen to what they have to say. Then together figure out a solution to that problem so it doesn't keep happening. Okay. Both of you should share solutions, not just you, also the person you're meeting with. Okay. Step 5, set up a meeting with the next superior. So if either you couldn't come to a solution or you did and it didn't change, then the last step would be to set up a meeting with that next superior person, either your boss or the professor or whatever. Okay. The key here in this situation is having the conversation with the person first. Don't go above them. Don't complain to other coworkers or classmates or your boss. Give that person the opportunity to become aware of the problem and how it's affecting you. Give them the chance to fix it before you take it to that next level. The other key is actually listening to their side of the story. Okay. Now let's talk about how to communicate with your patients. Okay. So the best way to treat your patients and get positive outcomes with all of your patients is to build a strong rapport with them. Okay. This starts with communication, verbal and nonverbal communication. Okay. When your patients start to feel seen and actually heard by you, they start to connect with you and trust you. And that's building rapport, right? We have that as therapists. We have that amazing ability. We get a good amount of time with our patients. If you look at how much time we get to spend with our patients versus a physician who may be in their room for 5 minutes, right? They don't get a chance to feel heard by a physician who only spends 5 minutes with them. But if we get a full hour treatment with them, or maybe even 15 minutes in the acute care hospital, and we give them the chance to tell us how they're feeling, we can see them, we can hear them, they start to kind of trust us more, connect with us, and they build that rapport with us, okay? So for communication with your patients, step 1, start with the small talk, right? Ask them what they did this weekend. What's their favorite movie? What did they do for their career? What book are they reading right now? Are they binging anything on Netflix? What's the coolest thing you're talking about at school with your friends, right? Just start with small talk. Okay. Step 2, find a connection with whatever they say, right? Continue the conversation from here. So share your thoughts and feelings about whatever they said. Okay. Maybe you ask them what they did this weekend. listen to what they say, talk to them about it, ask them details about how, oh, well, where did you go? What was it like there? What did you do for fun? I've never been there. Tell me more about it, right? So you can build on the conversation from here. Then tell them what you did over the weekend, right? What your favorite movie is, what book you're reading now, what your plans are for the weekend, right? So ask them the question, let them tell you, and then you just answer the same question back. Share your thoughts. Okay. Step 4, make any mental notes of the things that they're saying, right? Where are they comfortable sharing information with you, right? They may not want to share all aspects of their life with you, but if they start to kind of let you in on one little area, make a mental note of that. And that's where you can kind of always come back to. That's where they're comfortable with you. So that's where you can come back. Okay. Step 5, bring these up in the future, right? That's your in. Whatever they felt like talking to you about, that's your in. You can always reconnect with them there. Step 6, this is just kind of a general kind of tip, but avoid too much medical jargon. We all learned that in school. We know don't use all the medical terms, but explain things in simple terms. Maybe what's going on with them, why you're having them do a specific activity, but keep that simple and light. You don't need to spend a ton of time here, right? You don't want to spend, let's say you have 45 minutes with a patient one-on-one, you don't want to spend 35 minutes of that talking about their medical diagnosis and what that means, right? Maybe just a couple minutes, and then you start talking, whatever they wanted to talk about, whatever pathway you found to connect with them, talk to them. Some people just want to talk, right? So let them talk. And then as you give them a new exercise, okay, so we're going to do this exercise because we need to strengthen this for this thing that was hard for you to do, right? That's all you need to say. I don't need to go into too much detail on the medical side. Okay. So it's very important to know how to open up all doors of communication, right? Whether you're communicating with your boss so that you can avoid frustration and overwhelm when kind of those not so good things are happening in your clinic and you want to ask for something, right? Or you're like, ooh, I'm feeling too much pressure with this thing that you asked me to do, and you need to have that conversation, right? It's important to know how to communicate with your coworkers when you're feeling stressed or taken advantage of over and over and over again. It's important to know how to communicate with your classmates when you're feeling burnout because they're not pulling their own weight, right? It's also really important to communicate with your patients so that they know that they can trust you, they can understand that you actually care about them. That's when you'll get the positive results with your patients, okay? Communication, especially communication around difficult topics or tough subjects, can be very hard. I'm not trying to say it's always easy, but it does get easier the more you practice, okay? Nobody likes to have these hard conversations. Nobody wakes up in the morning and say, yay, I get to have a tough conversation with my coworker today. Nobody likes that, but the more you do it, the easier it gets and the less you'll have to do it because you're communicating how you're feeling with everybody that you work with, okay? You always have the right to stand up for yourself, to ask for what you need so you can be successful, to ask for help so you don't feel stressed, overwhelmed, frustrated. You have the right to get the help and respect that you deserve, whether you're in school, whether you're on a clinical, or whether you're at work, right? If you are not able to communicate with others, whether that's your boss, your CI, your coworkers, your patients, those feelings of frustration and stress and overwhelm, isolation, they just continue to grow and eventually they boil over and you experience the burnout, okay? Helping therapists discover how to best communicate with others is just one of the areas that I guide new grads and even seasoned clinicians to figure out in my complete clinician mentoring program. It is different for every single person. There are different strategies that can be used, but the steps that I shared today is a really good place to start, okay? If you feel like getting over that communication hurdle is just going to be really, really hard for you, a real struggle, reach out, send me a message, let's chat, drop complete in the comments and I'll send you a message. But communication is absolutely the key to success and happiness in your career. So please let me help you figure out how to strengthen this very important tool so that you can continue to enjoy your career for a long time. I'm tired of everybody burning out, everybody wanting to leave. We can't have it. That's my mission, is to help you figure out how you can get better or strengthen or improve whatever's frustrating you at work so you can stay in this career for a very long time. I hope you learned something new today. Please go ahead and drop in the comments your aha moment, maybe something that really stood out for you or something new that you learned. Whether you're watching on Instagram or you're watching on Facebook, whether you're watching live or the replay, please just drop it in the comments what you learned, what stood out for you. I want to thank you for watching, whether it was on Instagram or in the Facebook group. If you have any questions about what we talked today, please feel free to message me or just drop your question in the comments and I'll definitely answer. I'll see you next time.